not be able to join us. There you go. And we also have, for the first time, we'll have Dr. Huse from Douglas County. Dr. Poor was with us the first 2 times. Dr. Huse will be with us. And then from Hastings, we have Dr. Bever. So this is the first time we've had a broader statewide view of what's happening. So with that, I know we're all very curious as we look ahead to 2022 and planning our events and fundraisings and trainings, and hoping we'll learn a lot more to help give us good guidance as we move forward. So with that, I'm going to turn it over to Dr. Khan to get us started.
Good morning, everybody, and thank you very much. Always a real pleasure to chat with this group, and grateful for the invitation. You're right, this is the 3rd time. So since these are recorded, I'd like to hear in chat what I said before that I was completely wrong about. It's always good for me. It's nowadays, whatever you say, somebody's kept record of it, right? So you know if you got it right or you didn't get it right. All right, so I'm going to give a quick I love the questions and answer section so much better. So I'm going to quickly go over what's going on nationally, a little snapshot of, I think, of maybe a couple of less than a couple of slides of locally, because we're very fortunate to have both Dr. Bever and Dr. Huse on the call with you to give you the local picture. So let's get to my slides. Share screen. Let me get at least 1 thumbs up if somebody can see my slides. Yes, thumbs up. Okay. So I think I may have said this during the first or the second webinar we did, which is that what we're seeing now is not new. And I make this point that we will get past, we will go to a post-pandemic time here, but I'd like people to recognize that we will always be at risk for the next pandemic. And we need to make sure as we start talking about preparedness, and this is at multiple levels, right? So this is for you as organizations. I usually give this talk in the context of local and state public health, but for you as organizations to be thinking about what does this mean in terms of your planning as you move forward, not just from this pandemic, but for future planning to be ready for this disruption. So nobody, obviously this was extremely disruptive, but you know, this is just to make the point, you don't need to read it, that this is not the end, even when we get through this pandemic. This is a global snapshot for you. So 23 months into a disease we didn't know exist, over 5 million cases and over 253 million, 5 million deaths and 253 million cases. This 5 million is wrong. It's more likely 17 million is what I'm reading as we look at, because lots of people weren't tested, lots of people don't report, et cetera, but it's probably closer to 15 to 17 million deaths worldwide in 22 months for a disease that did not exist. And what's been clear is that the devastation of the healthcare issues are devastating, right? Here in the United States with our almost 800,000 deaths, but the political, economic, and social implications are bigger than they are for the pandemic. And so I say political, economic, and social implications in addition to the health implications, because that is the framework I use to say, when do we get post-pandemic? Not post-COVID. We're still going to have COVID, it looks like. We sort of made a decision a very long time ago that we were going to let COVID exist, unlike other countries. But how do we get to post-pandemic? So it's within those contexts. So let's look at what's going on in the US. So basically, for those who follow me on Twitter, what you're seeing is a surge within a surge. So all of these surges in the or waves, as they're called in the US, were associated with different viruses. This was your alpha wave right here in the spring, for those of you who will remember. This was the Delta lovely wave, and this is the continuation of the Delta wave. So you'll notice we never really came down from the Delta wave. So I was talking earlier in the fall or summer when you probably heard me when I said, you know, I'm worried about an additional winter wave. So here's your winter wave essentially happening right now, which is a surge within a surge. And this is happening across the US in multiple states. So what else have I got for you? nationally, yeah, cases are up 11% nationally because of that surge within a surge. But thanks to vaccines and monoclonals, what you'll notice is that hospitalizations in the US have not kept pace with the increased cases, which is good. I want to see a little less linking between cases and hospitalizations, and I want to see a little less linking between cases and deaths. Deaths are still low. Now, this isn't a guarantee. Obviously, deaths and hospitalizations follow the initial cases, right? So you got to give it a couple of days to 2-3 weeks to see if those are going to go up, and they may go up a little bit, but hopefully not as much as we've seen in the past, because people are more likely to be vaccinated. And if you do get sick, if you're vaccinated, it's milder disease. And if you do get sick, we now have monoclonal antibodies, which are really quite excellent at keeping you out of hospital. So that's essentially what we're seeing happening nationally. Do I have a sub-region? No, let me before I talk about it. So there's 31 states in the US currently that have increasing cases. So those 31 states, including Nebraska, which had a 50% increase in cases, I believe, in the last 2 weeks, are making up this surge within a surge. And the reason, again, I'm showing you hospitalizations are going down, which is a good thing, going back to how do you get to post-pandemic, but that's not true everywhere. So there's 14 or 15 states where hospitalizations are going up, including multiple states that have essentially de facto, they're not providing care for patients anymore, because they're just not that they're not excellent physicians, hospitals, healthcare facilities, nurses, doctors, healthcare, respiratory therapists. It's just there's too many patients, right? And so you just have to accept what happens when too many people show up. They're not going to get the same quality and level of care that they would have gotten on a routine sort of healthcare day. So that's a problem. So increased cases are a problem for that reason, because of what happens to healthcare. Here's what's going on in Nebraska. So the number, so this is 44 cases per 100,000 per day in the United States. You really want this number to be 5 or less. I like to say it needs to be 2.5 or less. So essentially, we have 20 times more cases than we should have in Nebraska currently. And the infection rate, the best way to look at this, if it's 1 or lower, it's stable or going down. If it's 1 or higher, it means we are getting increasing cases. And yes, we're getting increasing cases. And the number of people who test, you want less than 5% to be positive, and 14.3% are positive in this state, which means not enough people are getting tested, which means this number here is low. It's just not a real reflection of what's going on. So there's even more cases in the state than the numbers would have you believe are occurring in the state. Let's see, for Nebraska, for Nebraska, our current cases are more than the Delta surge. So and I believe this is true for Douglas County too. So we now have more cases than we had at the peak of Delta. And I sure hope they're not going to go up much more than they are currently, but that's where we are. Hospitalizations are pretty stable, have been stable for about 6 weeks, has been deaths here within the state. Vaccinations are too low to try to get this under control. So I think our 12 and up is pretty close to, this may be Nebraska. I think they're actually maybe pretty close to the national average. But we need to get this up to 85% to really make a big difference. These were, oh yeah, here. Is this Nebraska? No, this is Douglas County. This may be hard to see this little sharp increase here, but in Douglas County, there are more cases today than they were at the peak of our Delta wave. So the only thing that we're below, fortunately, is the big winter peak that we have. But we've now had more cases than every other surge in this state, except for the winter surge. What else? Oh, this is about workforce. So lots of people are planning on coming back to work sometime for the most part in January as they get through the winter months, and that makes a lot of sense, and I'll try to explain why that makes a lot of sense. The strategy when you decide to make a decision to bring people back to work is, what are those multiple layers of protection to make sure that you don't have transmission within the workplace, right? That's the part that you can control. You can't control transmission in the community, but you can control transmission in the workplace. and you'll have to make individual decisions based on the nature of your workplace of what measures you want in place as you bring people back into congregate settings within the workplace. Number one of them for me, obviously, is going to be make sure you have a vaccinated workforce before you bring them back. And that'll make the most difference of all of the other measures. This may actually be my last slide. So people often say, Ali, what are you talking about when you say post-pandemic versus post-COVID? So post-COVID would be no more COVID cases, and we're going to get COVID cases. So for me, post-pandemic is when there's no more of this sort of health, social, economic disruption that's going on. So you're not shutting down businesses anymore. You're not shutting down schools anymore. Healthcare is working as normal, and so that's what, to me, is the post-pandemic phase. And you are trying to limit cases somewhat, because I personally want them limited, because the more cases you get, the more likely you get a new variant, which we don't want. And the more likely you are to get long COVID, which you definitely don't want. I actually was chatting this weekend with a friend of a friend who has long COVID, and she's not been able to work for a year. After giving COVID. And this was a person who was highly productive, legal career, and it's just has been unable, because of the brain fog and the fatigue, to work for a year. Now getting better, but that's a long time to be out of commission because you had COVID. So here's the 4 things that I think will get us to post pandemic. And these actually align really well if the president's mandate takes place pretty much mid-January, right? By January 4th, everybody's supposed to be vaccinated. So you'll have a higher proportion of people vaccinated. For me, I'd like that number to be 85%, to be honest with you. And so between the adult mandates and all these kids who are getting vaccinated between 5 and 12, I think we'll get closer to a number where more people are protected. More testing. So the federal government is putting $3 billion into testing. So there'll be a lot more testing available. And this will be a game changer for us. So by December, I expect 2 new antiretrovirals to be approved in the United States. One of them has already been approved in the UK. And these will cut hospitalizations and deaths by 50 to 90%, which is tremendous, right? So essentially, this makes it a flu. Right, a mild, flu is not a mild disease, but at least it cuts down the devastation that we've seen with this disease, which is 10 times worse than flu, to make it as significant as flu. So we're excited about the oral antivirals. And then, so what you do is you have the rapid testing, and then if you test positive, you call your doc, and they prescribe a pill twice a day for 10 days, and you should be fine. And then the final piece, so I don't like to talk about the going back to normal. I always want to talk about a better normal, and that better normal to me includes a more robust public health system. We definitely need more personnel, better trained personnel, and better systems, especially health systems in public health, so we don't find ourselves in this place again. And that needs to include healthcare preparedness, and all of this needs to be focused on an equity lens. The pandemic didn't create health inequities. What it did, it is highlighted health inequities that have existed a very long time within our communities, that you on this call, for the most part, spend a whole lot, if not all of your time, most of your time, addressing these inequities within our community, right? So I'm sure this resonates with everybody on NAM, is how do we build better systems that are more resilient and that are focused on equity and equality within our system. And I think do I stop? I think I stopped there. This is in your workplace, that get people vaccinated, continue the daily health screenings, continue the other routine washing your hand stuff. You'll notice I stay away from hygiene theater. You will never hear me say deep cleaning, God forbid, anywhere. And this part I do want to make, which is your staff and employees are stressed. They really are. My guess is you're stressed. And if you're not, you probably are not being very truthful to yourself, right? And so how are we addressing the mental health, self-care needs of our employees as we bring them back to work? I think should be top of mind for everybody as they bring people back to work, about what does that mean and how are we making sure that we're addressing some of the mental health impacts of it. Let's remember, for many individuals, their lives have been completely restructured over the last 2 years to be working from home. So what does it mean all of a sudden when people come back into an office setting, right? And so I think you need to think about that as part of your reopening plans. It should not just be an issue of, show back up at work on January the 7th or 12th or 15th or whatever. I think this mental health aspects need to be part of that thinking also. And then I like to remind people, hope begins with the U. And so I want hope officially respelled with a U instead of an O, which you can do in the English language, because who knows how the heck they spell things in English anyway. So good magic, this is my usual message for everybody, promote some science literacy. The health information is killing us. Misinformation is killing us out there. Be politically engaged. And finally, I'm tired of COVID super spreaders. I want some hope super spreaders out there. And for those of you who need excellent new employees, the College of Public Health produces some amazing people, including people like Alex, who helped put my slides together today. All right, that's my plug for the college. Hope I wasn't too long and too fast.
You were neither, and fascinating as always. Great information. I see some people are putting questions in the chat box. Rosie is gathering those, and we'll get to those a little later in the programming. But right now, let's go outside of Omaha a little bit to the Hastings area. Dr. Bever, can you talk to us a little bit about what you're seeing out there?
Sure, great. Let me share my screen. Just one moment here. There we go. All right, can you see that?
Yes.
Okay, perfect. Thanks so much for having me. I really appreciate this opportunity, and it's been fun to see people popping on here. I see friends and colleagues from our area and from across the state. And I wanted to really start by thanking NAM members for all you do and have been doing actually throughout the pandemic, addressing the many needs and making differences in large and small ways alike in the lives of Nebraskans. It's so important to have all of your organizations assisting us in Nebraska. So I just wanted to give a little bit of a perspective from the rural part of the state, from a local perspective of what's going on. And great to hear Dr. Khan's overview, and you'll see some repeats and some reiterations of some of the things he said that we're seeing locally as well. And I just wanted to start by saying, since the last time that NAM had an update, I believe was in November of 2020. So I was just looking at some of the many things that have happened since that time. In mid-December, and actually November and December last year, we were putting some mask mandates in place. Some of our communities were working on that. And we had our first vaccine arrive in Nebraska. We had directed health measures that have been gradually removed since that time. And on June 30th, the state of emergency was officially ended by the governor. In mid-July, at least in our area, we had our first Delta variant sequenced for a patient in our area. In August, the governor declared a hospital staffing emergency and restricted elective surgeries. In October, the state lifted its ban on elective surgeries. We've ended a school year during this time. We started another school year. We've had discussions about vaccine mandates as we've moved through and have more vaccine available. So a lot has changed over this period of time. And I'm going to talk a little bit then about what we're seeing in our district. And we've had some data adjusts. I guess we've seen data come up and go down at the state level, but the local health departments are trying to keep our area's data up to date and available for people who are wanting to make decisions based on what's going on in their local communities. And so for South Heartland, our dashboard, you can see kind of what Dr. Khan was showing as well, that we had this early wave in the very first version of the virus back in the spring of 2020, and then a huge wave in November, December of 2020. Our Delta wave that occurred in July, August, into September, and was declining, and now we're seeing an uptick again as well. In our area, we've seen over 6,700 cases, and we are seeing that our case rates, our community transmission has continued to go up and down, and it's on the upswing again. And the two things that we're using, many of the health departments had risk dials up, and a few still are maintaining risk dials. We moved to look at just two metrics that are informing our area of the community transmission. One is the number of cases per 100,000 in the past 7 days, and Dr. Khan showed you a daily case rate per 100,000, and just so you know that these numbers are for 7 days, so they look much higher than what he was showing. But if you're over 100 in 7 days, that's considered high with the CDC numbers. And so right now in our overall for South Heartland, we're at over 400, and our counties are varying from over 700 down. In one county we're at just substantial, we're actually in the orange in that county. But we're seeing this continue uptick now, and that's concerning. And if we look at positivity, again, we're seeing increases in positivity, partly because of lower testing, but also because we believe that there is good high community transmission going on. So this is one of the things that we're watching, and we're tracking that with our green, yellow, orange, red metrics, so that folks know what's going on in our district. And also we've had a new variants, and the state is showing those. As I mentioned, we had our first Delta sequenced in July, and since that time we've had 68 variants that sequenced that were Delta, all of them Delta since July. And we've seen our share of deaths. We've had 99 deaths in our district that have been confirmed to be associated with COVID. And that's a 1.5% case fatality rate, which is actually higher than some areas of the state. So we are, again, also seeing additional hospitalizations as we track the hospitalizations of our particular residents. And we had a large surge following the November case upticks. And now we're seeing again with Delta that we're seeing increases in hospitalizations. And here's that hospitalization tracking. We track what's going on we have 3 hospitals, 1 major hospital and 2 critical access hospitals in our district. So overall, we've been seeing an increase. We were down to 0 COVID patients, the 0 COVID patients, and the percent of COVID patients. Actually, can you see my cursor? I need to come over here. 0 COVID patients, and the percent of inpatients that are COVID were 0 in June and early July, and we've seen a steady increase in that over the course of the last several months. The number of actual COVID patients in our hospitals was 17 again this morning's report. We've had a couple of 17s and a 16 in the past few months, matching what we had in December last year. So we're concerned about that. Our hospital capacity is continuing to stay, the number of staff beds available is continuing to stay low. And we're hearing across the state of the frustrations of our care teams in large hospitals and small hospitals alike, that inability to accept transfer patients, inability to get patients transferred, not just COVID patients, but this is, everything, folks that need to have, that have had accidents or have heart concerns or strokes. It's a concern across our state, whether we can provide the care we need. Not only are people tired and we have staffing issues, but having the right and appropriate care available where people need it when they need it is a struggle. So that's kind of where we are with our cases. This is not dissimilar to other jurisdictions in our state. And some of the things that we've continued to do, I know Dr. Poor talked about PPE in the past, and this is something that we've been warehousing and managing personal protective equipment since early on in the pandemic. We received our last large shipment from the state this summer, and now we're ordering it as needed, and we're primarily servicing long-term cares and when they have outbreaks, and providing PPE for other special need. needs occurrences, most of the providers and facilities are back to their own process of ordering supplies through their own vendors. But we still have a pretty decent warehousing and distribution function. And we've distributed since the beginning of the pandemic over 200,000 certain kinds of masks, over 300,000 surgical masks, over 50,000 cloth masks, over 34,000 face shields, 3,000 goggles, over 1,300 hand sanitizer containers, 10,000 containers of wipes, over 858,000 gloves, et cetera, et cetera. So just moving a lot of personal protective equipment to support our local folks. And this is something that's not something that we were used to doing, but we became pretty adept at it as we were going forward as an important part of our role in our communities. And one of the key things that was such an excitement for us in December was that vaccine arrived, and that we were so thankful that we had an effective prevention mechanism that would be available to help reduce this pandemic. And our staff were just thrilled to be able to offer it. And we started, of course, with our frontline healthcare workers that were in high-risk occupations like hospital and clinic staff and EMS. And we worked with our providers. In our area, we worked a lot with providers, hospitals, clinics, pharmacies to help make vaccine available and accessible to people across the district. We also are doing our own clinics, community clinics, but relying heavily on those vaccine provider partners. Those that are approved through the state immunization program for outreach and accessibility of the vaccine. And that's been a key effort for our health department, is managing vaccine for our partners. And the priorities changed over time. Of course, we opened up as more was available. And early on, there was a high demand for vaccine, more than there was available product. And people were often frustrated for their waiting for their turn as this happened. And it was exciting that we had National Guard deployed that helped us to manage vaccine and assist in clinics. And we were giving vaccinations in tents outside of meat processing plants. We were in gyms and churches and community centers. We were providing vaccine in homes for homebound, and just as best we could, getting vaccine out to people as soon as it was available to their eligibility status, and as soon as we had product available. And a lot of that changed as the different types of products came out with different requirements. So it was a logistical management nightmare as well, but so exciting to be able to offer that to people. And this is what it resulted for us. When we look at the vaccine uptake, this graph shows South Heartland residents that were newly fully vaccinated received their second shot in a particular week. And you can see we had this great increase over time as we had more vaccine available and more groups available, eligible for the vaccine. And then we had this huge drop off where very few new folks were getting finishing out their second shot. So we had a little uptick in August when that Delta started up, but it's dropped off considerably. And in our district, we only have about 45.5% of our residents fully vaccinated. That means obviously 55% of our folks are not vaccinated. And that's where we're seeing cases, that's where we're seeing hospitalizations, and that's where we're seeing the deaths. 48%, a little over 48.6% of our residents with at least one dose. But we're finding that that's not fully vaccinated, and that's providing more risk if you only have one dose. So again, we were quite excited to be able to offer boosters, offer third doses for those that were immune compromised. And as the new eligibility for ages has decreased, that's been exciting as well. But still, we're not seeing a large uptake, and a lot of that is misinformation and some politics and some leadership, and a lot of factors going on in that, I think. So the other thing I wanted to point out is, excuse me, that we're tracking uptake by age, and you'll see that with those that are 65 and above, we're over 80% for that age group, which is awesome. And part of that is because we had a federal pharmacy program that was helping in the long-term care and was able to help move that out and get lots of folks of those age groups vaccinated. And then you can see the drop off with the ages, and down at 12 to 15-year-olds, we're just about 18% for our district, partly because they were eligible later and partly because there's been just not a lot of uptake there. And we've been tracking those that are taking up the vaccine based on race and ethnicity and trying to close that gap. And we've been feeling really good about that. This gap was quite a bit larger for us earlier on, and we're closing that gap now for the Hispanic Latino population in our district by offering special outreach events, et cetera, to reach that population. So one of the things Dr. Khan talked about was testing, and I just wanted to comment that the Test Nebraska was ending, actually stopped in July this last year. And so people needing testing are needing it for a number of reasons: to determine if their symptoms are COVID or something else, so that they know how to respond to that and what actions to take, to determine if it's some other respiratory illness, to shorten their quarantine. Sometimes people want to do that, and so they're wanting to get tested. They need to travel, many people, and so they're wanting to get testing for that. So this has been a huge issue for us, trying to meet the testing needs and assure that testing is still available across our district. And many providers are offering testing now, but it has been difficult to not have that convenient drive-through Test Nebraska available frequently and at no cost, and with easy access and easy test result return. So we've been working kind of hard trying to bring additional testing in our area. We've not been successful to the point that we'd like to at this point, but people are doing a pretty good job in our area getting tested and finding testing. So it hasn't gone down as much as we expected, or as much as some of our neighboring health departments have seen. So we're happy about that, but it's an important piece, because if people aren't testing, then we're way undercounting the number of cases we have. And then people, in some cases, are not testing because they don't want to know, and they don't want to have to take actions based on that. And I think that's just continuing our spread as well. So testing is a huge piece. Contact tracing is still something that's going on. There's sort of the traditional contact tracing that our local health department is still doing some of. There's also the DHHS survey link that those that have mobile app, if we've turned that on in our area, we have. Not every district is doing this, but if you're over 18 and you have a mobile phone listed with your testing sample, then you can receive a link, and you will fill out a survey that's a survey-based contact tracing, and you're answering some of the same questions you would if you were talking to a person. And then we have do-it-yourself contact tracing as well. And this is something that sort of a shout out to Nebraska Association of Local Health Directors too. As a NAM member, the health departments have relied on NALED heavily over the past 2 years, and it's because of them that we've been able to do some of the things so professionally and have available for the public. So we really appreciate them. But the do-it-yourself contact tracing piece is one of those that is available for folks, and we share that widely, hoping that people will, if they're not getting tested at a provider's office, if they're not answering their phone or following up with contact tracing, that at least they would have a way to know what they should be doing, and to help contact their own contacts and let them know that they've been exposed and what they should do. So there's kind of 3 ways that we're working on this, but we're finding that, contact tracing worked very well for the first year of the pandemic, but now not so much. There's concerns that lead to the underreporting of disease transmission, and that also keep the transmission from decreasing, because people aren't testing, they're not answering the phones or completing the surveys. We're seeing a lot of that now. People aren't providing information if they do answer the phone, and people or if they do answer the survey, they're not providing all the information. So we really don't know how many contacts they have, and people aren't following the recommendations for prevention. So this continues to be a struggle in our nation, in our state, in our nation, compared to what's happening in some other places. Quarantine process has adjusted a little bit since you talked probably in November 2020, but it's really the same idea, that you stay away away from other people, so that you don't spread the virus when you are developing the disease, which can be prior to symptoms, you can spread already. So the idea that you're less likely to spread after day 5, after day 8, after day 11, and if you've tested negative at those times, that there's opportunity to shorten that and wear a mask for the remainder of those 14 days. That has not, recommendation has not changed. We've worked with another school year started. We worked with schools a lot this summer. Many health departments did, and we were trying to help them know what the status was and also what they could plan for and what the guidance was. We worked regionally with our schools and with other health departments to provide tools and awareness. The guidance from the state for schools this year was very different from last year. So we didn't have any directed health measures in place, and their guidance was just that guidance, but it was very different from CDC guidance or from what many of the local health departments were hoping for. For school-aged individuals who've had close contact, they could meet conditions in lieu of quarantine. So instead of staying away from folks, they could monitor daily for fever or other symptoms. And did not have, there was no mask requirement. So we're finding that we're seeing a lot of cases in schools now. There were some schools across the state who started with mask mandates, most and none in our area. Most across the state, I don't think we're not doing mask mandates. And it seems like it's hit and miss whether they are using masks for quarantine in lieu of quarantine when people are coming back. So we're seeing quite a bit of spread in our area in schools. And also we feel like there's under testing in schools as well. Lots of the young folks are not testing. Breakthrough cases, we are seeing breakthrough cases. This is data from the state showing from January 1st, 2021 through October 23rd, the number of cases, fully vaccinated versus not fully vaccinated, hospitalizations and deaths as well. We're seeing similar things here when we look at our vaccination status of our hospitalized patients and looking at those that have died. Generally, when there are fully vaccinated folks who are needing hospitalization or have severe illness, it's because they have underlying conditions or immune compromised and probably didn't have as much protection from the vaccine as they and we would have liked. And one of the reasons for having those third shots or the booster shots, depending on that status. So the vaccine is working, and our state epidemiologist provided some data for October 12th through October 9th, showing that unvaccinated people have a 3 times greater risk of testing positive for COVID-19, 12 times greater risk of being hospitalized for COVID-19, and 13.2 times greater risk of dying from COVID-19 compared to fully vaccinated individuals. So there is breakthrough, but the risk is so much greater for severe illness, hospitalization, and death if you are not fully vaccinated than if you're vaccinated. So that's where we're continuing to provide support for vaccine and putting large efforts into getting vaccinated. But our pandemic's continuing because we aren't getting vaccinated to the degree that we need to. And just looking back at the data I showed before, we're seeing a huge uptick again. We flattened in the summer, seeing large upticks in cases, and our hospitals are filling again because we have a pandemic of the unvaccinated now. So what can we do? And I'm going to put this back up what Dr. Khan showed as well. What we can do and what we hope that you will do is, as the pandemic continues, that we have some opportunities. Dr. Khan mentioned monoclonal antibodies and the new antivirals. These are huge and helpful therapeutics as well. But it comes also down to the basic prevention mechanisms that we need. With the sort of, one of my staff said this morning, I think the fear of COVID has dropped off a lot. And that's kind of led to folks not following prevention measures anymore. And they're weary, I understand that. And we all understand that, but people's actions are leading to these upticks and are leading to the hospitalizations and the lower hospital capacity. And so we're putting ourselves in this situation, and we need to continue to take all of these layers that we can, use them as often as we can, wherever we can, to help reduce the spread of this virus until we tame it a little bit more, and it's more like a seasonal virus that doesn't have as much of an impact on us. We've seen cluster outbreaks in a business last week. The year before, they said they had all these things in place. This year they got lax. They weren't doing much for their workforce in terms of prevention measures, and they've seen a little cluster outbreak now, and that's impacting their workforce. And we talk about the economic recovery pieces. We need to think about how not requiring masks or not having some of these things in place are also going to reduce our workforce. So we need to think about that. So I'm going to, I think, stop there and just encourage all of you as nonprofits to think about how you can utilize these, continue to serve as leaders in our communities. Businesses and nonprofits can serve as leaders in our communities to help lead the way with some of these sometimes unpopular but necessary measures to protect our communities, protect our employees, and protect those folks that we serve in our communities.
Excellent. Thank you very much. Can you hear me right now? Can somebody give a thumbs up? My Zoom controls are okay. Very good. I have lost control of pretty much everything on Zoom, so I don't know what's happening, but we're going to go with it. As long as you can hear me, we're good to go. Thank you, Dr. Bever and Dr. Khan, for this wonderful information. This has been so very helpful. We a bunch of people put questions in during the registration process. We've had a very active chat, so we've got lots and lots of questions. One note. Dr. Huse was going to join us today. Unfortunately, something has come up and she is not able to join us. She's had a bit of an emergency come up, so we will not have her with us today, but we do have lots of questions. So I'm just going to go ahead and dive in. So lots of questions about vaccine mandates in workplaces. Any recommendations on how to implement, or should we be implementing these in our workplaces? And if so, how? And along with that, so say you have a vaccine mandate for your staff, but then people in their household are not vaccinated. Any thoughts about how we as nonprofits can manage that for our staffs?
You want to take a stab, Dr. Khan?
I was hoping you were going to.
I can start, and I'll just
This is
say,
at the local level, but go ahead.
I can start, and I'll just say, we were really fortunate here at our health department that everybody got vaccinated, and we didn't have to have a vaccine mandate per se. Although now that we're hiring additional people, as new people come on, we're asking them to be vaccinated, in part because of the messages that we're providing, and we want folks that are comfortable sharing those messages because we feel like that's important. And now that's different from what's happening with federal vaccine mandates for a variety of organizations that are falling under that, and for what you might do if you're a nonprofit and not have those same goals necessarily. And so I think it's best if we can educate people and provide them with the information that they would decide to become vaccinated on their own. And everybody should have the opportunity to have a waiver for that because of medical reasons or other. Medical reasons would be the main thing I would see as a need for a waiver. But I feel like it's imperative that we share accurate and accurate and reliable and appropriate information about the vaccine so that people can understand the risks and the risks of not getting it and weigh that in a better way. And so I'm not necessarily in favor of mandates, but I see why it's important to do so when people are not taking action on their own. And if there's not ways that we're doing a good job getting the information across appropriately.
Mm-hmm.
So I'm glad that Michelle covered the compassionate parts of how to implement vaccination within your workplace. I consult for a number of large companies, including Major League Baseball, et cetera, and others. And I've been recommending vaccine mandates for all of them. There's very little even in the way of religious or medical exemptions for why people couldn't get vaccinated. Logistically, it makes things so much easier. Most of the people I consult for do not want their workplace disrupted. Right. So if you get a handful of cases, you got to shut down. The health department's going to probably provide you very little options if you're having ongoing transmission within your workplace. And so most of the companies I consult with, the reason they're bringing people back to work as opposed to letting them remain remote is for specific reasons. They need to be, otherwise just be remote, right? And so they can't afford a disruption. So for example, Southern California, right? Nobody's going to run the nuclear power plants from home. All right, somebody needs, you hope that's not being run from home at least, right? I'll be remoting into those control rods today. Hope my internet connection's working fine. So they don't want a disruption of their workplace. So I'm a big, I'll be honest with you, I may not be very politically correct. I'm a big fan of vaccine mandates in the workplace. And that then goes to all of these questions you're about to ask, I'm sure, about testing in workplaces and masking in workplaces. If you started everybody vaccinated, everything else becomes easier. If you want to increase the protection, then I have a colleague, various colleagues who do not like antigen tests, and I thought I saw something here about antigen tests. But if that's all that's available to you, you layer that in with twice a week antigen tests, and you should be good even without masks at that point. Again, thinking what local transmission looks like. For some of the counties that Michelle recommended, I'd just be in a biohazard suit walking around. But for some of the other ones, I think, if you're fully vaccinated and if you take prudent practices in large crowded indoor spaces, I think you're pretty protected.
So when we're at our offices and say everybody at our offices are vaccinated, does that mean that we can put our masks away, or should we still be masked when we're indoors around people in our offices? Say, not at the grocery store necessarily, but at work.
That's a great question. And we've kind of gone through that roller coaster ourselves at our office. And we're currently not wearing masks in our own offices when we're by ourselves, but when we're meeting in teams, when we're meeting with the public, we are wearing masks. And part of that is because the Delta variant is it's spread easily, and we know that we can still spread it even if we're vaccinated. So we may not get very ill if we get it. We can still get infected. It can be in our nasal passages, and we can share that. We have a great immune response because we were vaccinated, and so we don't get very sick, or we might not get sick at all. We might not even know that we had it there in our nasal passages. So we're still continuing to protect others by wearing masks. And just on a personal note, I have a 100-and-a-half-year-old father-in-law who I'm going to visit for Thanksgiving. We went back to his birthday in April, and we all were vaccinated in April, and we all wore masks around him. Going back, this time again, he's vaccinated too, but I don't want to take that risk because his immune response might not have been as good as mine was, and we don't want to take that risk. And on another personal note, I'm not willing to even get COVID in a mild form. When I see people who've been vaccinated and have gotten just, they have cold-like symptoms or whatever, they think it's allergies, and then suddenly they lose their taste and smell. And for me, that's a huge quality of life issue. I love to cook. I love to smell the fall leaves like I did this weekend. I want to the flowers. I mean, losing taste and smell is a huge quality of life issue for me, and not everybody gets that back. And and it's a safety issue too. So I'm continuing to wear a mask whenever I'm out in public, and people probably think I'm mask Nazi and health department, whatever, but it's something that I'm very, very passionate about, and I want to share that with other folks. And some of our staff have sort of taken that on too. They're like, "You're right. I don't want that either, and I don't want to share it with others." So we're continuing to wear our masks.
So Rosie, what I've been recommending is essentially the same that you just heard. Everybody vaccinated. And that if they're going to meet in groups of greater than 3 to 5, sometimes 10, whatever, that they, for those congregations, they wear masks. And again, this is a function of local community transmission. If there was no local community transmission, I wouldn't even say masks. But where there is significant local community transmission, I do believe there should be indoor masking. And I've consulted with 2 companies that are just against masks indoor. But they're all fully vaccinated. And I said, well, in those circumstances, what you could do is you could layer on testing instead as another way to protect the workplace. They all, as far as I'm concerned, all of the companies I work with, everybody's required to do a daily check-in on some sort of symptom check or whatever. So nobody comes to work sick. I don't care if it's a runny nose. I don't care if it's a sneeze. I don't care what it is. You don't come to work if you're sick, because as you just heard from Michelle, you may think it's allergies. You may think it's whatever. So sick people are not allowed at work, period. They have good monitoring for who does get infected. So they always know what's going on within the workplace.
I'm going to come back to the layers as well, because it's not just masking. I mean, there's other things you can do. You can practice that 6-foot distance. If you're in an enclosed space for, an hour, then you might consider wearing a mask. But if you're passing in the hall for 5 minutes, then maybe it's, not such a big deal. But we've also got little X's around our department. So stand here, don't stand here. We're continuing to do some of those things. So all of those layers are things that we can do. It's not just masks or vaccine, or, all of those things are good to think about and how we can incorporate them.
Thank you. The other lots and lots of questions about events. We're nonprofits, we have fundraising events, we have galas, we have whatever. Thoughts about returning to in-person events. Can we do that? What safeguards can we put in place? If so, just in general, thoughts about events. Are small events okay, but big events maybe not yet? Just in general, what your thoughts might be.
I think events are certainly okay. I just think we need to consider how they can be safe, like we did all of last year when there were directed health measures forcing us to think through these things. So are there ways that we can separate folks out a little bit in terms of where the tables are? Can we cohort at all? Can we make sure that we have hand sanitizer available? Do we want to require masks or have them available so that those people who maybe are more at risk or feel strongly about something feel comfortable coming to the event too, and don't feel like they need to exclude themselves because you're not going to have anything in place that will help to keep them safe? So keeping options available for people, and holding things outside if you can. It's getting to the time of year when that's not as much of an option, but it's safer if we're outside and not packed in small, tight, needing to shout loudly to the neighbor because we can't hear. All of the thinking about the type of event and how you can make it safer. I think events certainly are. Let's do things like that. That's a better normal.
Anything to add, Dr. Khan?
It's a county level decision on what's allowed or what's not allowed, coupled with good common sense of what you should or shouldn't be doing, depending on what local community transmission looks like. I believe once we get into the middle of January and we do get to a post-pandemic state, then really it's an individual decision whether you did or didn't get vaccinated, and if you're willing to take your own risk of getting sick or not, whereas others based on their health condition. So for example, if Secretary Colin Powell, right, he'd wear a mask all the time, right? Somebody who has multiple medical conditions will still decide to wear a mask even in a post-pandemic phase. So I don't think you're very far in the new year. I'm not sure who asked the question, that regardless of what the local recommendations are, I would feel very comfortable in saying, yes, go ahead and hold your events at that point. I did see a comment about cases dramatically rising in the community and facilities deciding to drop mask mandates. Usually it doesn't go in that direction. Usually it goes the other way. More cases, you do more. But you know what? It's Nebraska, so you get used to it.
That is the truth. Yes. All right. Well, thank you. So we are at time. I know that there were some questions that we didn't quite get to. And so please keep them coming, send them to NAM. We will do what we can to get information out as needed. We've always got all kinds of stuff going on. So bring us your questions, your concerns. If you have questions about what policies you can put in place, we have templates for you, all that kind of stuff. We will get that to you. So please feel free to reach out to any NAM staff. We are always happy to talk this through with you. Big, huge thanks to Drs. Khan and Dr. Bever. This was a wonderful update. Thank you for being accessible to us and for taking the time to do things like that. And thanks everybody for joining us. All righty. Well, let's
Always a pleasure. Thank you.
Always a pleasure. And also don't hesitate to forward things our way, my way. If there's things that would be appropriate for me to help answer, I'm happy to do that.
Same here.
Thank you so much. Thanks all. Bye-bye.
Thank you.